Hi, good evening. I'm Dr. Surendra Patil and I'm the joint replacement and joint reconstruction surgeon at Polaris Healthcare, Pune. Today I'll be talking about what all preparations one need to do before he is planning a knee replacement surgery, what we commonly call as a total knee replacement surgery or TKR. So essentially, as we know that this is a very planned surgery. It is planned over a period of weeks to months, at times for years also. Many of the patients, they drag it over years, and when it becomes totally difficult for them, at that point of time they go for a surgery because of the lot of the myths associated with the procedure. We will be talking about that in a subsequent videos, but today we'll be talking about what all the preparation one need to go for the knee replacement surgery. So essentially, if I have to talk about the preparation, I have to break them into four different topics. Number one is the part preparation, or that is we call as a knee preparation. Number two, that is the mind preparation or getting mentally ready for the things. Number three is house preparation or the making the support system ready for the surgery. And number four is what all you need to prepare yourself, or what all you need to pack before going for a knee replacement surgery. So let's talk about each one in details. So coming on a knee preparation, what I mean with it is preparing the muscles around the knee joint, means creating or getting or developing the essential strength in the quadriceps muscles and the hamstrings muscles around the knee joint, which are the main muscles of the thigh bones. So once you develop a good amount of strength in the quadriceps muscles, a good amount of strength in your hamstrings muscles by doing a regular set of exercises, by doing a regular set of range of motion exercises, by doing a weight training exercises using a weight cups of a half a kg, quarter a kg, or maybe at times 1 kg depending on your strength. All this will help you to develop a strength in the quadriceps muscles and the hamstrings muscles, which are the main muscle for the post-op recovery. So once your surgery is done, the ability of yours to walk efficiently, smoothly and painlessly, it is directly depends upon the strength of the quadriceps muscles and the hamstrings muscle which you have acquired before the surgery. We have seen it in our practice n number of times. A sedentary patient usually take a longer recovery time, mainly because of the weak quadriceps and hamstrings muscles. On the contrary, a manual laborer or a farmer who's working into heavy kind of works, who has got a very good quadriceps and hamstrings muscles, they show miraculous recovery. Their post-op walking, their post-op ability to stand, climb stairs on a second day and third day, giving up the walkers by the end of 10 days to 15 days is phenomenally good compared to the people on whom there is a sedentary lifestyle leading to the weak muscles. Research has also proved it that this kind of a prehab, that is the exercises before the surgery, has given a very good positive outcome after the surgery in terms of the functional recovery of the patient. The second point is getting mentally ready. What does I mean by this is, one has to be mentally ready for the surgery. That means the patient, the person who is undergoing a surgery, has to accept the entire process, understand the entire process. He should be involved in the decision making, and it should be his informed decision of undergoing the surgery, so that he can participate positively in his entire post-operative recovery process. We all know a positive mindset leads to a positive outcome. So similarly, the surgery, before the surgery, if you are having a positive mindset towards the surgery, towards your own outcome, then this will be definitely helping you out towards getting a faster recovery out of the surgery. You will be getting lesser amount of a pain, and your support system will also be equally happy. What I mean by the support system is by means of your family members, the doctor teams and the nursing team, which are helping you out for the during the entire process. The third preparation which I am talking about is creating a support system or preparing your own home. Once What I mean by that is, once you go back at your home after the third day of the surgery or the fourth day of the surgery, you need to have a support system ready at your place. And essentially it comprises of someone, a dedicated family member or some kind of a dedicated nursing staff member who will be assisting you for your day-to-day activities, like getting out of the bed, helping you to move around the bed, going to the toilet. So a dedicated family member or a dedicated nursing assistant can help you out for these things. A well in advance preparation of such kind of support systems takes out lot of your mental agonies and frustrations post surgery. Secondly, you need to arrange certain things like a commode chair or maybe a commode raise, because post surgery, most of the time, because of the quadriceps weakness, a patient may not be able to use a normal height commode which has got a lesser amount of the lesser height. So by giving a commode raise or using a commode chair, it becomes very comfortable for the patient to use commode chair, and getting up from the commode chair or the commode becomes very easy, and patient gets in his life in a more easy and very smoother way. Essentially, if required, if the floorings are more slippery, one needs to put in some kind of grab bars in and around the area where the patient is moving. These are very, very important in the initial period of a time, till the time the patient develops a good strength in his quadriceps muscles and the hamstrings muscles. Now let's talk about the last but not the least, as what all we need to prepare or what all we need to pack when we are going for a surgery. So essentially, you need to carry all your pre-operative checkups reports, you need to carry all your doctor's reports, you need to carry all your x-rays which has been done before planning for a surgery and advising you a surgery. You need to carry all your essential medicines of diabetes, blood pressure, hypertension, thyroid, or any other elements of which you are taking a regular medicines. You need to carry prescriptions of those medications for diabetes, blood pressure, hypertension which you are taking and has been prescribed by some other doctors like your physician or someone. You need to carry comfortable clothes, so immediately after second day of the surgery you can slip on your comfortable clothes so that your stay in a hospital will remain very, very comfortable and you will feel at home. You need to have a comfortable slip-on shoes, so once we make you start walking, standing and moving around, you can just have a slip-on shoes and you can move around in the hospital lobby with the help of a walker. You should carry, if you really love to read books and all, so you should carry certain kind of positive thoughts books which can motivate you to do furthermore better outcome, and a good books will help you to have a better time in a hospital while you are recovering, and definitely it will keep your state of mind also in a very positive frame. Essentially, apart from this, you must carry your identity proof like an Aadhaar card or driving license or any other kind of an ID proof which can at times required for the insurance purposes, or you need to submit them at the time of your admission process. You need to check all these things in details before you are planning or getting admitted with the hospital authorities wherever you are getting your surgery done. And the last but not the least, I will definitely suggest you that whenever you are planning such kind of a surgery, plan it well in advance, at least 3 to 4 weeks before your scheduled date of a surgery. Try and meet your doctor. Try and meet the support system, the nurses, the physiotherapist, those who are going to take care of you during the surgery or post-operative after the surgery, so that you will have a sense of familiarity with them, you will have a comfort level with them, and all these things put together will ensure your very good recovery, because a bond is already been established between you and the surgical team which is going to operate you. Essentially, this is a very well proven surgery. It's a reproducible surgery. It takes away all your pains and it gives you a new lease of life. So to conclude, this is a very positive surgery. This is a very reproducible surgery. Once the surgery is done, you become totally painless. So essentially, those who are undergoing for a knee replacement surgery, I will urge them to go with a very positive state of mind, very good physical strength in their muscles around the joint, and with the proper preparations and planning. I wish all of you who are planning to undergo knee replacement surgery a super success after your knee replacement surgery. Thank you.